Hi everyone, my name is Dr. Bhagyashree. I welcome you all to my YouTube channel Heal with Homeopathy. In today's video, we are going to talk about how to select potency in homeopathy. In Organon of Medicine, aphorism number 146, Dr. Hahnemann mentions about the third most important point, that is the judicial employment of artificial morphic agent, that is the homeopathic medicine. In homeopathy, homeopathic potencies are divided into three scales: decimal scale, centesimal scale and 50 millisimal scale, that is LM potency. In today's video, we are going to talk about centesimal scale. So centesimal scale in homeopathy, in centesimal scale, the potencies are divided into high, medium and low. In low, up to 12C, it is considered as low potency. 30C and 200C is medium potency, and 1M and above, they are considered as high potencies. So high potency. So what are the indication for high potency? Number one, if there is a close similarity between the patient symptom and that of the remedy's symptom, then we can think of high potencies. Number two, if in any case there is predominance of mental symptoms, we have to think about high potency. Number three, if the medicine, if they are inert in their crude state, we have to give this type of medicine in high potency. Then number four, nosodes. All the nosodes should be given in high potency. Then if the patient leads sedentary lifestyle, means he doesn't he is physically not very active, and if he is working, if he is more of a mental work, he does more of a mental work. For example, sitting in front of computer and doing all the software kind of work, or teaching stuff, or if he is a student, these kind of people, they need high potencies. Indication for medium potency. In hypersensitive patients, which tend to prove every medicine they get, so we have to give them medium potency. For example, 30 potency, 200 potency. So what do you mean by hypersensitive patient? Hypersensitive patients, these are very sensitive for mental stimuli or even physical stimuli. So mental stimuli means for small reason they get easily offended, they start crying, they get affected with smallest stimuli. These are mental stimulus. Then physically they get easily affected with cold, cough, these kind of symptoms. These are very hypersensitive. They have this allergic tendency, they get easily affected with allergies, maybe you say urticaria or in any rashes because of allergy. They comes under the hypersensitive patients. So in hypersensitive patient, we need to give medicine in 30 potency. They respond better to 30 potency and 200 potencies. The indication for low potency. Number one and most important is when we see the patient who is working hard physically or physical laborer, we need to consider low potencies. Number two, when in any case you find more of the physical symptoms, for example warts, varicose vulgaris, cracks, or like these symptoms, you need to give low potencies. Then if you find in your case gross advanced pathological symptoms or changes in tissues and organs, you need to give them low potencies. Then if you see in your case that there are more of the physical symptoms and more of the more of the organic changes, you need to give low potencies. In organ remedies or medicines which are given for particular effect, these type of organ medicines, they are not proved properly, so we need to give them in low potencies. Example for these organ remedies are Parera brava or Thalaspibursa or Osimum. This kind of medicines we need to give them in low potencies. The patient who are not very sensitive, you can start your medicine from 1 mg or you can give higher potencies. Then in some cases we have to give ascending potency. For example, you have started from 30, then after when you see that this potency, now this medicine in particular 30 potency now is not acting curatively, then you can go to the 200 potency, and then from then to 1 mg. Like that you can give series of potencies of the same medicine, that is ascending potency you can give. What do you mean by hypersensitive patient? Patients which are very sensitive to mental stimuli. For example, if anyone scolds them for small things, they get irritated, they start crying, or they get affected with any kind of mental stimulus. These are called hypersensitive patient. Even physically they are very hypersensitive, means because of small cause they get irritation in their skin or in mucous membrane. For example, they have tendency to get recurrent cold and cough, they have skin allergies, they are prone to have urticarias or rashes or eruptions. These are the hypersensitive patients. So these patients are sensitive physically as well as mentally. So in this type of patient we have to start with 30 C or with 200 C. We have to give them medium potency. They respond well to this type of potencies. Hi, I am Dr. Bhagyashree. If you are watching this video for the first time or you are new to my channel, do consider to subscribe my channel, because in every video I am posting some clinical tips or some information related to general disease condition and how we treat them in homeopathy. So please do consider to subscribe my channel. Do like these videos, do share them with your classmates or colleagues or known people so that they get benefit from it. Thank you so much.